After this webinar, we will be sending out an email with a brief evaluation. We'd really appreciate it if you took a minute or two to fill it out so we can provide the best programming possible. And then our next webinar after this one is on November 30th with Dr. Angela Wandinger-Ness. She'll be speaking about women in research and leadership roles, successes and challenges. And finally, you may have seen some communications about it already, but our technical training summit here in Albuquerque, New Mexico in March 2023. Registration for that exciting event is now open. I will pull this slide up again at the end of this webinar, but you can scan this QR code for more information. And without further ado, we will go ahead and get started. Thank you for joining us today. We are excited to hear from the NCI team. I will turn it over to them. Thank you.
Thank you, Shoshana. I'll be sharing the slides. Hang on one second. How does that look, Beirut?
Oh, that looks good.
It looks good? All right.
Thanks, Anthony.
No
Thank
problem.
you, Shoshana. I think we can get started here. First and foremost, thank you for the invitation from the GMaP Region 3 to the NCI Program Directors. We are really excited and delighted to be here to speak with our trainees in the region. And to get started, it's going to be a tag team presentation, and it's my distinct honor and pleasure to have both of our diversity training branch chief, Dr. Behruz Damani, and integrated networks branch chief, Dr. Leanne Bailey, with us today. And I would like to ask Dr. Damani, who would be giving the overview of the flagship programs, but it would be nice to hear from both of them. So I will hand it over to Dr. Damani. Please go ahead.
Thank you, Anil, for invitation, and thank you to our GMaP 3 region for organizing this webinar. In the next 20-30 minutes, my team and I plan to present funding opportunities at CRCHD and supported by CRCHD. But before that, going to details of each funding mechanism and opportunities, I wanted to give you an overview about the CRCHD in general, its mission. So as you can see in this slide, CRCHD, or Center to Reduce Cancer Health Disparities, focuses on 3 areas of programming, which is disparities research, diversity training and workforce, and outreach. So then we have multiple programs falling under diversity training. The team will be present on most of them to you today. The network programs, these are like GMaP is part of the networking program, and in addition, there are new initiatives at integrated network program focusing on outreach and networking. One is connecting underrepresented population to clinical trials, or CASP-C2, and a new initiative actually came out today, fresh out of the oven, Transformative Educational Advancement and Mentoring Network, or so-called TEAM, which is an R25 program. And congratulations to the team for these new initiatives. We have also focused on the disparity research, and there are multiple opportunities such as R21 basic research and other opportunities that we are going to discuss, including the R01 that falling under disparity research programs. In addition to that, our center is focused on the building research capacity, especially in forms of supporting the partnership between cancer centers and institutions serving underrepresented students and underserved health population. So many of you maybe are familiar with the P20 and U24s. This was an overview of the CRCHD in a nutshell. Next slide, please. So first, going to the NCI diversity training program and the programs that are supported by my branch. Our flagship program is called CURE, which is Continuing Umbrella of Research Experience, or CURE. It has been existed in more than 25 years, and more than 3,000, close to 4,000 trainees have been supported through the CURE opportunities. CURE is using a holistic approach, research training and career development pipeline network to support trainees at each level of this continuum education, from middle school to early stage investigator. We have programs that support high school students, undergraduate, postbacs, predoctoral, postdoctoral, and early stage investigator. When the initial CURE was mostly at extramural environment, it means that universities and organizations outside the NIH, in 2017, we will also launch the iCure, which is the intramural continuing umbrella research experience, when those eligible candidates are coming to NIH and get training at NCI labs. So again, my colleagues are going to discuss the details about you the next coming slides. Next slide, please. For most of these programs, there are some eligibility requirements, and we particularly encourage applicants from individuals from groups listed in this slide, based on the race, ethnicity, disability, disadvantage, background, to apply for these opportunities. I highly encourage you to read the notice here, notice OD 20031, and work with your institution if you are eligible as one of those categories to apply. We understand the underrepresented and diversity maybe varies from setting to setting, but this is up to you and to your institution to work together to determine. We always also encourage you to reach out to the program officer at NCI to make sure that you can apply for these funding opportunities and other opportunities that maybe are not funding opportunities, but coming to NIH, working in NCI labs. So please go and review this notice, get familiar with the requirements, and work with institution about the eligibility requirements. Next slide, please. A CURE is more than a pipeline, is an ecosystem of support that we're providing. Examples are listed here, such as technical assistant workshop. This is part of today's webinar, is part of this technical assistant webinar. We, of course, provide professional development workshop. Mentored research experience is the major thing that the investigator receives support at their university organization under a designated mentor. We provide the mentored mock review workshop, communication platforms, visual communication platforms, and navigation connecting trainees to the right mechanism. So we are looking as the whole holistic approach, which includes not only funding, but also mentoring and other means that the trainees need to be successful. Next slide, please. And this slide just summarizes the funding opportunities that we offer at the center and DTB. There are individuals awards and there are institutional awards. The institutional award is R25 years that I'm not going to discuss it today, but other individuals awards include diversity supplement, F31, K programs, which is K08, and K22, R21 and R01 that you hear in details in the next 20 minutes. And with that, I think it was what I wanted to give you an overview about the CRCHD, and I will turn it over to my colleague, Dr. Belém Lopez. Thank you.
Thank you, Dr. Devani, and thank you everyone for attending our webinar. As Dr. Devani said, my name is Belém Lopez, and I help co-manage the diversity supplements. So a little bit about the diversity supplements within CRCHD. The purpose of these is to provide additional funding to currently active NIH grants to support research experiences of trainees. And this funding serves as sort of bridge funding to get a particular diversity candidate to the next career level. That might be getting someone at the undergraduate stage into a graduate program, getting a postbac into a graduate program, or getting that early stage investigator to the stage where they can get their first R21 or even an R01. So some requirements for applying for a diversity supplement is that your parent grant must have at least 2 years of active status left at the time of the supplement application. And at this time, NCI does not accept P30s as the parent grant for these supplements. And in terms of how many supplements you can have for a grant, R01 or equivalent R01 grants can have up to 2 supplements at the same time, and R21 or equivalents can have only 1 supplement to support a graduate student or more junior candidate. And we accept these applications on in 2 different cycles. The first cycle is always from October 1st to December 1st, and it's currently ongoing, so we're receiving applications. And our second cycle starts February 1st through March 31st. So what are the things that we look for in a diversity supplement grant? What we first, we need to make sure that the candidate is eligible based on the notice that Dr. Devani previously stated. This might be folks from different racial and ethnic backgrounds, socioeconomic status, or disability, or things of that nature. So I encourage you to look at the NOCI and if you're eligible to apply. We also, the diversity supplement applications are also rated on 3 different aspects. One being the candidate, if they're eligible. Also the research. Is the research that's being proposed relevant to the parent grant? So we don't necessarily support new science, but it's science that falls within the scope of the grant that's already funded. We also want to make sure that the candidate is obtaining necessary research to move to the next level. So as one statement that needs to be prepared is a career and mentor statement. So what are the clear benchmarks that the diversity supplement candidate is going to reach during that time of funding? But if you have more questions about the diversity supplement, or you're interested in applying for the diversity supplement, I encourage you to reach out to myself or my colleagues, Jo Beth McCarthy and Dr. Jason Liu. Next slide, please. We also have what's known as research supplements to promote re-entry and reintegration into health-related research careers. One being the re-entry supplement, which can fund a candidate who's been on a research hiatus for 1 to 8 years, but they must be at the postdoctoral level or early stage investigator level before going on this research hiatus. And we also support reintegration supplement, and these supplements are to support individuals who have been adversely affected by unsafe or discriminatory environments due to unlawful harassment, who need to make a rapid transition from one lab maybe to another. And here we support folks at the predoctoral, postdoctoral, and early stage investigator. And again, if you have additional questions about either the diversity supplement or reentry or reintegration, please feel free to reach out to us. And at this point, I'm going to turn it over to my colleague, Anthony DeBillo.
Hi, thanks. Thank you, Belem. Yeah, so today I'm going to present to you the F31 diversity program. And again, my name is Anthony DeBello. I'm the program director for the F31 at NCI. The purpose of the F31 Diversity Fellowship is to enhance the diversity of the cancer research workforce by supporting the research training of predoctoral students from diverse backgrounds. Again, based on the notice that was mentioned before, this includes groups from underrepresented groups in general, race, ethnicity, disability, socioeconomic, et cetera. And this award, it benefits the trainees, the student trainees in a number of ways. For one thing, it facilitates and provides support for individualized, mentored research training, primarily given by their faculty sponsors. They receive training in and gain experience in the communication of their research, via things like presentations, scientific writing. It also provides them with a chance to strengthen their grant writing skill set. And, I think in general, all of this, in particular, the grant writing experience, helps make fellows more competitive for NIH funding going forward. The student fellow is the PI on the grant, and I think one of the most important things is that this fellowship generally improves the chances of that individual becoming a more a successful independent researcher in the future. And this the fellowship supports trainees for up to 5 years for those working on a single doctoral degree, like a PhD program, and it supports fellows for up to 6 years for those working on dual doctoral degree programs, such as MD, PhDs. We have 3 application cycles per year in April, August, and December. And we in general, as others will say, have said, and will say here, is we're in general really happy to answer your questions, to help you look over your application materials and provide other any kind of support that we can. And so if you have any questions, if you're simply interested, or you have practical questions regarding how to prepare your application, I very much encourage you to reach out to me directly. My contact information is here on the slide, and it also can be found on the website, the CRCHD website. Let's see, sorry. And next, I'd like to hand it over to my colleague, Dr. Laritza Rodriguez.
Thank you, Anthony. Good afternoon, everyone. My name is Laritza Rodriguez. I am a program director at CRCHD, Center to Reduce Cancer Health Disparity at the NCI. I manage the K mechanisms, the R21. I co-manage the P20 and the U54s. So talking about the K awards, basically they are, the main objective is to provide protected time and salary support for 3 to 5 years of intensive training and research. To promote career development activities to enhance the candidate's research capabilities. And the expectation is that the awardees will be prepared to lead independent research programs. That means be prepared to write their R01 application by the end of the award cycle. Their requirements, as well as the underrepresented background and the others that my colleagues already mentioned. We're looking for strong, academically strong candidates with prior research experience and publications. That does not mean that you have to have an extensive library of publications, but you have to be able to demonstrate that you are capable to perform research. The proposal must include a well-defined research project with scientific impact and structured training activities. We need an experienced and well-committed and when funded mentoring team and an advisory committee for the K-22 and in general for all the Ks. As I said before, these are mentored awards, so they should have a mentoring team, either a main mentor or a mentoring team. And we need institutional commitment to the candidate for a 75% protected time or 50% protected time for surgeon scientists. Next one, please. There are 3 K mechanisms. The K01 is mentored and the K22 is non-mentored. It basically depends on the background of the individual. I am not going to read all the numbers, but this is a nice comparison table that will indicate to you wherever you might be eligible to apply. And the KO8s are for clinicians, basically, and they also have salary support, the same duration, and they're also mentored awards. Next one, please. This is the list, which I am not going to read, but it's here for your reference, of the KO1, the KO8, and the K22. These are the current FOAs. So please go review, determine which one of them you might be eligible to apply. And if at the end of all this reading, you're still confused, please, please, please reach out to us. Either me or my colleagues, anyone at the center will be more than happy to talk with you. But don't hesitate to contact us. That is very important. During any stage of your application, please contact us. Next one. My colleague, Sharuz Baedi, is in charge of the KO1 and the K22, and I mostly handle the KO8. But between both of us, either one can reply to your inquiries. The due dates for applications are on the slide. They're also on the FOAS. Prepare early, work hard, and please apply. Next one. I also manage the R21 Exploratory Grant Award to promote workforce diversity in basic cancer research. It's basic cancer, no clinical trials. It's the PAR 21061. This award is for early stage investigators or new investigators who have not had a previous R01 or grants over 175,000 direct costs per year. So you might be saying, well, wait a minute, what is the difference between the Ks and the R21s? We mostly encourage people to start out with the Ks because you're going to have a prolonged period of time where you can get mentored, where you can have additional training. And if at the end of that period, you still have a need for preliminary data, or you haven't quite been able to establish your lab, or you need more time for whatever reason, or you come up with a novel idea to do some additional research, then that's when you want to apply to the R21. The R21 is only a 2-year award, and it's a fairly small one, but it has pretty much the same requirements as far as the research project. It does not require a career development plan. The next due date is coming up November 17. The next one is in June, and again in November until we renew. Next slide, please. We also have the program called SURE, which is the Support for Research Excellence. The main objective is a research capacity building program designed to develop and sustain excellence in United States academic institutions. There are 2 types. One is to support faculty investigators with prior experience in externally funded independent research, but who have not been funded by the NIH. And the other one is, it's a first independent award. It's basically to support research grants for faculty investigators who have not had any external independent research. It requires a student involvement plan. Remember, it's for faculty. A plan to recruit students, including those from underrepresented groups, and strategies to involve and train students in conducting research and research participation. And the next due date is May 26th. Next one, and I believe this is the last one. Next slide, please. And with this, it is my pleasure to introduce my colleague Gregory Adams, who is going to talk to you about the CURE and iCure research experiences at the NCI. Gregory?
Hi, everyone. Actually, I'll be covering the iCure program.
Okay, sorry.
It's all right. Again, hi, everyone. Belém Lopez. I am just kind of covering the intramural continuing umbrella of research experiences, or iCure research experiences at NCI. So as with other programs at CRCHD, the goal is to increase diversity in the cancer biomedical research workforce. And one of the goals is also diversifying the workforce at NCI campuses. So the iCure program provides mentored research experiences at NCI campuses in Bethesda, Shady Grove, Rockville, as well as Frederick, Maryland. And individuals who can be supported through iCure can be individuals at the post-bac stage, so after undergraduate level, for up to 2 years, graduate students as well for up to 2 years, and postdocs for up to 3. Applications are currently being accepted from now through December 15th for research experiences to begin in fall 2023. And there's a link here where you can get more information. And so something to note is that even if you're interested in applying, or you might have students who are interested in applying, they don't need to pre-identify a PI at NCI to apply. They can just apply. And if you have additional questions, please reach out to the program directors, Dr. Gregory Adams and Dr. Jessica Calzola, and their email is in the slide. And now I'm happy to turn it over to my colleague, JoBeth McCarthy.
Thank you, Dr. Lopez. Good afternoon, everyone. My name is JoBeth McCarthy, and I co-lead the Early Investigator Advancement Program, otherwise known as EIAP. We currently have a call out for proposals or applications to the Early Investigator Advancement Program. It states here on the slide that it closed on November 1st, but we recently extended that to December 1st. So if you are a new or early stage investigator and are seeking support in terms of R01 grant application assistance and support with mentorship and educational opportunities, please reach out to Dr. Jay Revaleza, my colleague here, or myself, or and anyone is willing to support you in preparing your application. It's a very simple application in terms of a cover letter and some other materials such as reference letters and a draft R01. It's not a full R01, but a draft R01. So maybe you have submitted a previous R01 before and received feedback, received your summary statement as well as your score. Once you have the summary statement, you are more than welcome to use that grant application or that R01 application, as long as it's just once, to the EIAP for consideration. Our program starts in the first week of March. So get your application in now before December 1st. I should provide a little bit of a background with regard to the EIAP. It started in 2021, so we're entering into our first year by the National Equity Council at the National Cancer Institute. And really, this is to facilitate the advancement of scientists from diverse backgrounds to become independent investigators and otherwise acquiring an R01. The cancer research enterprise needs a continuous flow of talent through the research career pipeline to thrive. And one critical juncture is the transition from junior investigator to independent investigator. And the EIAP aims to enhance professional skills, guide preparation of an R01 grant application, provide access to mentoring and peer network, and grow a community of emerging independent investigators from diverse backgrounds. Again, the deadline has extended to December 1, and if you go to our website here at the bottom of this screen, or contact Dr. Rizavalela or myself, we are happy to meet with you and discuss ways in which you could prepare your application and become an early investigator advancement program scholar. Next slide, please. Another program component is the Professional Advancement Virtual Engagement Series. This is a monthly webinar. We are aiming for the last Wednesday of every month, although with holidays it might vary. But the primary aim is to provide career skill development and professional networking opportunities for early stage investigators, new investigators on such matters that really many investigators are challenged with. Maybe that might be developing your your NIH BioSketch. We have a webinar on that. We also have a webinar on navigating both the private sector and research arena and tips and skill development on ways in which to do that. There are a host of different topics that we provide each month, and if you're interested, we welcome you to contact my co-lead here, Caitlin Garfinkel, or myself, and we would be happy to add you to our listserv. Next slide, please. Next, I would like to introduce you to my esteemed colleague, Dr. Tiffany Wallace.
Thank you, Jobet. I will be covering for Tiffany here. She is not here, unfortunately, today. So our newest initiative is the NCI Cancer Moonshot Scholars Diversity Program. It's R01, and this is part of the White House Cancer Moonshot Initiatives. And we are super excited that this program has been approved, and we launched it a couple of months ago. And the first application it's today. I mean, you have 2 hours to prepare your R01 application and to submit it. Just kidding, because we always ask the candidates that to start early, and for each mechanism application, it requires almost like 6, 8 months, 9 months to start working, writing your specific aims, and contacting the program at NIH. So anyway, this is the R01 that was the FOA was launched 2 months ago. The science that we are asking, in difference from the R21 diversity, which is only basic science, it is a broad areas of cancer research, including cancer biology, cancer prevention, cancer diagnosis, cancer treatment, and cancer control. All divisions and centers at NCI are in. It is a program that NCI-wide program, is not only CRCHD, they are involved. The point of contact for this program at CRCHD is Dr. Tiffany Wallace, and her email is listed in this email. So most importantly, we are focusing on the early stage investigators. You know what is the definition of early stage investigators? With a final degree, which is in the last 10 years, not longer 10 years, from groups that are underrepresented in biomedical, clinical, behavioral, and social sciences. So for this R01, similar to all other R01s, you need to include preliminary data in your application. Budget there is no limit, but it needs to reflect the actual needs of the proposed project based off this. And the maximum time of award is 5 years. This FOA at this time expires in February 2024. So there are 3 cycles that we accept application listed here today, June 6 and February 6, 2024. We don't know what happens after that, but if you plan to submit an R01 in response to this funding opportunity, start today because we don't know what happens in a year or like 16 months, 18 months from now. So with that, I wanted to summarize that. As you can see, we have multiple programs and opportunities to support a good science and a committed candidates. Please work with your program officer at NCI, especially CRCHD, and let's have a discussion how we can help you. I think there is a time for us to switch to the panel discussion. If there are questions, we are happy to answer your questions. Thank you. Anil, who is moderating this session, you or Dolores?
Oh, I was thanks to Dr. Dawani. I was just wondering if we have any additional slides or something. And
We
okay,
do.
so
We have the
are-
GMaP. Do you want me to go?
Oh,
go-
No,
sorry,
no,
go.
we are fine. So
Yeah.
we are fine. So we are open for the discussion, and I would like to thank each and every one who presented here. And this is our final GMaP slide. And the attendees of this webinar are part of the GMaP Region 3. And these GMaP regions are basically managed by regional coordinating directors at NCI designated cancer centers. And we have 7 such regions. And the idea behind this is to bring our all CRCHD funded trainees, research investigators to similar venues like technical assistance workshops or peer-to-peer mentoring and supporting travel scholarships and pilot funding. And if anyone is interested in knowing more about it, please contact us and we'd be more than happy to put you in touch with regional coordinating directors at various centers. So at this stage, I think we can open up this webinar for Q&A session, and please feel free to submit your questions through chat box, and we would be more than happy to work with each and every one of you if you are planning to submit any grant applications. So do we have any questions?
Anthony, could you please stop sharing so we don't need to see this? Let's see the last slide. Thank you. I think I see one question. Can seniors who graduate in spring 2023 apply for iCure's post-bac program? I think Jessica is online. Jessica, do you want to address this question?
Great question. Yes. If you're going to be graduating this spring, now is the time for you to apply because the applications are for research experiences that start summer to fall of 2023. So perfect timing, actually.
Thanks, Jessica. And we may want to elaborate here that the whole intent purpose behind holding these technical assistance workshops is that we want our trainees and potential scholars who may want to apply to all of these funding opportunities, training opportunities, feel comfortable in reaching out to program director. Chelsea, okay, go ahead. I see your hand is raised.
Yes. So,
please unmute yourself.
So last year, one of my mentors told me to reach out to the program director when I was applying to an F31. And so I submitted like an abstract of my potential project or like the specific aims page. And basically the response that I got was like, yes, this would be appropriate for an F31, but like there was no further conversation. So I'm not really sure like how to utilize the program director or what sort of conversations I should be having. I was just expecting a little bit more feedback or like help. So just what questions should I be asking?
Well,
Dr. DeBello, yes.
Yeah, I can answer that because I may be the person you spoke with. It depends on when you sent it in. But In general, a lot of times I get aims, just sort of a general specific aims page or something like that, and someone's asking, does the question, and I'm not sure, particularly, I'll take down your name and try to look back, but the question is often, is this appropriate for NCI or for CRCHD? So it's a question about scientific content and whether or not it's the right IC to direct it toward. So like, NCI versus NHLBI or NIDDK, these other NIH institutes. But normally once you begin, once you decide you want to go through NCI and you want to work with me, my goal is usually to answer questions about, I suppose, strategy, more than just specific scientific content. You're going to know a lot more about your scientific system than me. I can try to help, where I can, but a lot of times it's more questions about what are the kinds of things I should have in my training plan. So normally after you and I would have communicated over your just sort of basic project concept, we want to proceed, and I apologize if I didn't, we'd want to proceed with support on, I guess, like application strategy is how I would describe it. So things that the reviewers are going to want to see and not want to see, and some back and forth between us about how you can structure your application and emphasize certain certain aspects of the training and the research that are gonna be seen, lead your application to be reviewed positively. And I'm happy to talk more about what some of that is actually here if we have time, but we can also do it privately if you want to talk about it.
I just want to let you know that it wasn't you, just to relieve your mind.
I had an eventful year, so I've had quite a number of people that reached out to me, and it turns out that I didn't get right back to them. So,
just follow up on this question. So, we as program directors at NIH staff, we are here to assist you. This is our responsibility. And we will be more than happy to work with any candidate. What we want from you, that start early, reach out to us early, and be specific and ask a specific question that makes life easier for us to answer them. So for example, if you send an application, where is the due date for this submission? Probably this is not a very encouraging and heartbreaking, like, oh, I'm going to answer this question right away, because this information you probably can find on the FOA. So we want that you go and read the FOA carefully and ask a specific question. So the first one would be, is my application responsive to this FOA? And the answer is yes, no, maybe NHLBI or NIDDK is better, or NCI. But don't be shy. Follow up with the FOA. So send what we ask you at all candidates and ask a specific aims, probably the mentoring plan depending on the mechanism, and also your bio sketch. So we can, and follow up the question. So do you think that these specific aims are appropriate? My career development plan is appropriate? Those are specific questions. So again, I encourage you that all of you reach out to PIs, follow up. If they don't answer, follow up in 2 weeks or 3 weeks. And definitely put a catchy title. Don't send it from the Gmail account or your private account and those things, because some of times it's just blocked by NIH. We don't see them. Use the institution award, and oftentimes introduce yourself. I have received so many emails and said, oh, I want to submit this FOA. Am I eligible? And I have no idea where is this investigator, in which university. Please use signature block. I am a postdoc. Introduce yourself. I am a postback, because maybe everybody knows you, but we don't know you. Help us to help you. Help make life for us easier. We are here to help you.
I will add just a little to do. Please don't wait till 2 weeks before the due date of the application. And I have my summary statement from 6 months ago. I want to resubmit. Can you please meet with me tomorrow before noon? Actually, before 9 and 10 in the morning. Don't do that. This takes time. It requires effort. We're here to help you, but we're also tight on time. So reach out, insist, and we will respond.
And Chelsea, don't take it personal. It's not about you. It's about all the applicant that candidates.
Yes, no, yes.
Wonderful advice. I would like to add here to the attendees that most of us attend all national conferences, be it AACR or ASCO or Abercrombs or SACNAS. So we like to interact with all potential applicants who are applying to our funding opportunities, and feel free to come to our NCI booths at all these conferences. And I would also encourage everyone here attending this webinar to become member of MICR, Minorities in Cancer Research. So there we have special sessions and special booth for potential applicants where they can bring in their applications. We may want to go through them and interact with other program directors for getting helpful hints and guidance. So always come and interact and engage us with your research proposals. We are here to help.
I guess I have another question if nobody else does.
Sure, go ahead.
I'm interested in the F99K00 transition award, but I only see one application due date. Is there only one per year for that mechanism?
Behruz, you are muted.
Mechanism you said F99K00?
Yes.
Let me see.
I just see the next due date is November 18th, which doesn't really work for me, but I was wondering if there was one sometime in between, like now and when I might graduate.
Yeah, please shoot an email to Larissa or Sharos or the program director. I have to read the FOA, but I thought that there were multiple cycles, but unfortunately, I cannot answer this question now.
So we can support you because it is supported by our Center for Cancer Training branch. So we know the branch chief, Nastran Zahir, there. And if you can send us an email, and we'll make sure to reach out to her and the exact program director who manages F99K00. And it's a big portfolio at CCT at NCI. So we'd be more than happy to put you in touch with the program director.
You are right, though, Chelsea. What I can see there at the, I mean, I also don't know a ton about it, but it looks like there is one due date, November.
And may I ask you, Chelsea, why you want to submit F01 instead of F31? Because the program director didn't respond to you?
No, I already completed my F31 and it was reviewed and everything, but now I'm looking towards, transitioning to like a postdoctoral fellowship. I would like to be done with my PhD.
Congratulations. Okay.
So I had seen Dr. Bailey had turned on her video. If you want to say a few words.
Oh, no, I just wanted to chime in and say that it is true that we work very closely with our sister branch, the Cancer Center Training Branch. And so, we have a variety of mechanisms as discussed during the webinar, but we would like to see you be successful in whatever route you choose. So please don't hesitate to reach out to Shoshana or any of us here at program. And I did just want to say thank you so much for everyone's participation and for the great questions and the potential applications and conversations to come. Thanks so much, everyone.
Thanks, Leanne. So anyone else from CRCHD or the attendees who may be feeling shy, but please turn on your video and we would welcome your comments, any feedback. So Dolores, go ahead.
I just wanted to say a thank you from the, as kind of the hosting site for Region 3, we wanted to say thank you for everybody attending today, for the presentation, the thoughtful presentation you put together, as well as all of the important information and the great discussion we've had at the end. And thank you for everyone asking questions and posting. And Shoshana will post again our reminders for upcoming events that we will be hosting and things to look forward to. And again, yes, as Dr. Bailey said, if there are any questions about this or connections we can make, please feel free to email Shoshana or us. We have gmap@salud.unm.edu is our email address, so we can all access that and connect people as needed. So Shoshana will be sending a post webinar evaluation that'll come through for folks who registered to attend. We will have our next webinar will be at the end of this month. And then we are very much looking forward to co-hosting our technical training summit with Region 6. And that will be in March. And yes, registration is open and we're getting excited about that event as well, where we'll be actually covering some of these things here too as well. I'm sure the topic of how to work with your program officer will come up during that summit. We'll be discussing, and the hope is that a lot of folks who will attend that will have their specific aims drafted, and we'll have a mock kind of workshop through things like that, and lots of different experts in the in grant writing, and those who have received grants and things will be there to guide us junior investigators. So any other comments, Shoshana?
No, that's it. Thank you to everyone for attending, and thank you to our presenters. We really appreciate your time.
Thank you so very much on behalf of CRCHD program directors and leaders. We'll thank you all for giving us this opportunity, and we look forward to continuing dialogue. And it was not this one-time show, so we expect to hear from each and every one of you who are interested in applying to our funding opportunities. Thank you. Thank you all.
Thanks, everybody.
Bye-bye.
Thank you.